thank you so much for coming. I'm David Shirk, Director of Friends of Kijabe, and maybe you could say who you are and what you're doing in Kijabe right now.
Thank you for having me. My name is Joshua Emery Muhondwa. I'm a third-year Obs-Gyn resident in Kijabe.
So were you the first class?
Yes.
Okay.
I am with my colleague, Dr. Lynette.
Excellent. Okay.
Yeah.
And how is it going? How is Obs-Gyn?
Well, so far it's well. We thank God for the progress. It was a much anticipated program. Well, hurdles everywhere, especially with a new program, but we have a very good support team from our faculty.
And how did you come to Kijabe? Where did you hear about what we were doing here?
I interned here.
Okay.
As a medical officer intern back in the year 2021. Yeah.
Okay.
Yeah.
And so maybe tell me about your background. What made you interested in medicine? Why are you doing what you're doing?
Okay. My mom was a nurse because she retired. And I think that's the only thing I knew as a little boy. I grew up loving being a doctor, taking care of people, thinking through what is happening, processing, trying to figure out and, should I say, fix them, maybe? Yeah. That's what I ever knew.
And so when you say that, like, are you like looking at old people in church, or like who are you thinking about?
No, I mean, my mom would come and tell stories about the sick people she's attending to. She used to work in HIV-based research program, and so she would tell us. And so I think I was just intrigued by how well the doctors handle it and how people would get better. And so I think I was intrigued as a young boy, and I'm not sure if I should say I developed my passion, but that's the only thing I knew. I just want to be a doctor.
Yeah, from when you were young.
Yeah.
That's awesome.
Yeah.
Your medical journey. I mean, what is training like for somebody who's not as familiar with the Kenyan's medical system? What is training like, and how long has it taken you to get to the point where you're at now?
All right. So it all starts with being a medical student after you graduate from high school, and that takes 6 years overall.
And you're tracked directly from high school to medical school.
Yes. And so the program it's a 6-year course, 3 years of it being preclinicals and 3 years of clinical, where now you're exposed to a hospital setting, and then you attend through the major 5 rotation, that is psychiatry, obstetrics, pediatrics, general surgery, internal medicine.
Yes.
And so after it, you graduate with Bachelor of Medicine in Surgery, but to complete it, you need to do a 1-year internship. So that's how I came to Kijabe. And then after accomplishing your internship, then you get licensed for practicing as a general practitioner. After attaining it, that's now then you can further your studies, depending on whether you want college-based program or the related affiliated programs like now EXACOG for Obs-Gyn and COSEXA for Gen Surg and the rest that are available. Yeah.
Excellent.
Yeah.
I love that. Why? What was it about Kijabe that made you want to come and want to stay?
Okay. Kijabe, it's well endowed, rich in resources, number one, but also I think what I like it most is the fact that you're allowed to practice your faith. And so it helps you grow rather than drag behind. I think that's actually number one point. Yeah, the fact that it's faith-based and even here we do have support, like faith-wise, we have people who encourage you in department. So I think it shows that not only we're growing professional-wise, but even spiritual-wise, which is more keen.
I love that.
Yeah.
What maybe give a couple practical examples of what that looks like. Like, do you have mentors like in your department, or do you meet for Bible studies, or what does it look like?
Yes, we do. I mean, I think after we joined, not even during residence, but even starting internship, you were assigned a mentor. So like in obstetric, I used to have a mentor, Dr. Mameti, who's current our program director. And then later when we joined residency, still, as soon as year 1, we were assigned mentor. So I know the word mentor, most times it means socially, but these are people who even they check on you, on your well-being, both spiritually, how are you, and they allow you to share freely. So they are able to offer you the support you need from both background of professionalism to now the spiritual aspect. We have Bible studies as residents. I happen to be also part of the Bible study program that is involved in other residence programs such as anesthesiologist, gen surg, paid surg. Yeah, we do have a meet every Thursday.
Mm-hmm.
Yeah.
Mm-hmm. Excellent. Is delivering babies stressful?
No. Well, no, it's okay. At least to me, it has never been stressful. Let me be honest with that. Yeah. However, maybe now standing here, that's when you know it is somehow stressful because you really don't know the outcome. Growing as a medical student, all you want to see is people pushing. So you're really not aware of how things can go wrong. But again, advancing your studies, going to internship, after seeing the worst that can come from what was expected to be initially normal and eventful turn out to be uneventful, that's when you know that there's a lot of things that can go wrong. So yeah, now every time there's a development, you're somehow nervous because you really don't know the outcome of it.
What is the landscape maybe in Kenya? Because you mentioned that Kijabe is, I think your word was well endowed or like well resourced. But what is it like for moms having babies like in a normal situation versus Kijabe, and then how do those connect? Like, do people get referred here on time? Sometimes I assume they do. Sometimes I assume they don't. But I don't know. What is Kenya like for a mom trying to have a baby?
Okay, so referrals, yeah, there are those which get here on time, especially if the mothers have been well followed up. So that means if arriving into diagnosis is sooner and the facility would realize that they can't handle it, that's when they refer it. However, most times we get referral pretty late, like these are diseases which are already poorly managed, they're uncontrollable, and so you just receive it because you are on the edge. And in terms of the landscape, really Kijabe is giving the best. I trained in Thika level 5 and they were trying giving their best, honestly, but you can tell here we have machines for monitoring, which we call CTGs, which is not very available. At that time, I think we had only one in where I trained. And so it's hard because you're using a fetoscope, and as a student, you're forced to auscultate, but you're not really sure whether whatever you're hearing as a fetal heartbeat is what it is or not. And so again, that affects outcomes for that fetus. Unlike here, where it's a very objective way of assessing how the fetal status is. And so that's a pretty big variant, and working from one facility which was a bit of resource limited to now where you think you can fully provide the best for your patient. So it offers you and appreciate the major difference between the two.
When you say they had one CTG machine, like how many people would be trying to share that?
Oh, that's all. We were actually not even using it because no one knew how to use it. And even if they wanted to, you'd realize that there are no the strips for printing. So all you could use is to like auscultate one for in about how many a labor could accommodate around more than 20 women. These are in active phase, what we call above 6 centimeters. There are those who are in latent phase who will be waiting in another room. So it was a burden. Yeah, that was 4 or 5 years ago. I don't know the situation now.
Yeah, hopefully it's better. But it's a challenge in most places, and then even in Kijabe. How many machines do we have right now? The reason why I'm asking this is because I just got an equipment wish list, and there's more CTG machines on that. But I was curious what we have currently available.
So currently in our lab board, it's about a 6 bed capacity, and we have 5. However, out of these only 4 which are functioning. So sometimes we're forced to use the ones in the antenatal mothers and bring it here. So you're right. We need.
And it would be nice to have. We're going through a transition. I know some of them literally came in a suitcase that I carried from America. I bought on eBay and we carried over. And it's amazing they're still working, but we're in this transition in Kijabe to try and find both locally and kind of higher quality equipment. You start out somewhere. You have to start somewhere, but then bit by bit, it gets better. Where are you from originally? Where's home?
I'm originally Tanzanian.
Okay.
The southern part of Tanzania. Yes.
Excellent. Is Kenya different from Tanzania?
Slightly different, honestly. Slightly different. I don't think the difference is significant.
it seems like to me, and I'm just an observer. I've been here 11 years, so I'm becoming more Kenyan. But it seems like there's a lot of commonality for East Africa.
Yeah.
Like there seems to be like each place has like little differences, but like you can tell East African culture.
Yes.
I think pretty broadly.
Yeah.
So like you love Chapo.
Yeah. Very much.
What would be your dreams or maybe your hopes that either for you or for like the teams you work with? What do you hope to accomplish, as a obstetrician?
Okay, so our team broadly and us is to improve both maternal and fetal outcomes. As much as they include fetal, remember before they become babies or newborns, they're the ones who are managing them. So that's why I'm linking both the two. If we do not manage this fetus as well, the pediatrics, maybe they won't have much to do because the babies, or rather the fetuses, are already affected. And so it is a point that has to be well collaborated by both teams. And so by adequately diagnosing them on timely and instituting the right care, be it conservative or delivery, can impact that fetus status both on delivery and later. And maternal-wise, we know as for now, I think it's even worldwide concern that maternal mortality is a concern everywhere. And again, this can actually be reduced from awareness, education, and this starts both from patients to now healthcare professionals. By this, I mean even at the point of acknowledging that this is something that you anticipate could be of concern in terms of morbidity, and hence institute early referral to maybe a tertiary level. That is a major way of preventing maternal morbidity and mortality. As we know right now, PPH, that is postpartum hemorrhage, accounts for majority of, death. And so our goal is to improve all these things. And in Kijabe, I think we are doing well. Like last year, I think we had like only one maternal mortality, which is a major stride.
How many deliveries do we do?
Again, if I may put on
broadly,
maybe like around close to 1,000 actually. Yeah, because
that's
we're
good.
having much of cesarean delivery than again spontaneous vertex delivery, for reasons that are obvious, because of CTG, and again because we tend to manage most of our high-risk mothers. So because of this, you expect your deliveries to be high. And being a point of referral, it's another reason of why you're having more high-risk mothers, because our community trusts us, the infrastructure is good, well-equipped to manage anything. Our lab is good, so if you need blood, it's there timely, which I think we're really doing better. There are those which have happened, but even the ones that we lost them, it's because even in the US, the mortality is high. One of our women who died had amniotic fluid embolism. The literature says even in the US, there's nothing you can do. So that's why I say we really try giving a lot. And effort is made this because there are always doctors in the facilities, 24 hours. So there's no time that a mom can come and fail to be attended. And nurses are there, doctors are there, residents are there, consultants are there full time. It's one of the efforts that are being made. Yeah.
That's awesome. I would say my only complaint is probably a common complaint is the appearance. On my list, I have a very long to-do list. But coming soon-ish. Not next, but next is we want to build housing for our residents on campus, and then beyond that is working on a new outpatient facility, which actually that would affect your team, at least on doing prenatal care, like maternal child health center. It functions well. It's actually a nice space, but it could be significantly bigger and probably better equipped. But then beyond that, we'll start redoing the inpatient parts of the hospital. And so I would love a really nice birth center.
Indeed.
We're overdue. I think we're already 20 years overdue for that. But that would be, if I could do everything I want to accomplish, that would probably be my last project in Kijabe.
Last, why
So,
not
but
first?
that would be fun. Yeah, that would be really fun. Oh, just because the timing and scope and how long it takes to do like really big things. Yeah, because
I
this would
get
look
you.
like what they have on the master plan.
Yeah.
It wouldn't be just like redoing the maternity is now. It would be we would build the new outpatient and then demolish what is current outpatient and then build a big inpatient tower there.
Okay.
Yeah.
Well done.
Yeah, so it will take some work, but I think it's possible and will be really really nice because it's an evolution we're going through in Kijabe is to try to match up medical capability with we have really good clinicians, we have good equipment, but trying to get the environment to match the skill.
Yeah. Well, I pray that it comes into fulfillment. all of
Yes.
this.
I feel like this has been super helpful. It's really nice to meet you.
Me too. Thank you.
There's a trait that different doctors have different demeanors or different specialties, but I can tell immediately like you are very gentle, you're calm, which is a really important trait for your specialty. Like I know that the mothers love your care. I can tell already because you're a very soothing, like gentle personality, and that's really important because it's stressful. It's stressful having a baby.
Yeah, it is. But well, I think we have the grace to bear with that.
Yeah,
Yeah.
absolutely. So, anything that you would like to share as we finish? Anything we didn't talk about, or any questions or things like that.
Maybe appreciation.
Mm-hmm.
I think the fact that you're even working on thinking about the residents' welfare, especially coming up with the accommodation structure, I think that's very commendable, not only on maybe human eyes, but also godly eyes.
Mhm.
So yeah, I think that's very appreciative.
That's awesome. Thank you so much. Well, Josh, I appreciate this has been great to meet you and
Great.
really grateful for your time.
Thank you so much.
Santi.
Great.